What's up, guys? This is Josh from Upright Health. Today I'm going to talk a little bit about tight front of the hips and anterior pelvic tilt. So if you've watched this channel at all, then you may know that I have had some anterior pelvic tilt issues in the past, and one thing that really affected me was my fronts of the hip, right? My hip flexor region always felt really tight. It would feel impingement on movements, and I'd just get kind of general pain there. So one thing that I found that I couldn't do very well was I couldn't move my hip actually into flexion very well, right? So when we're talking about hip flexion, it's this motion, okay? So what I found, what was going on, was that I was actually just in a bad position for these muscles to work correctly, okay? So rather than these muscles being like really tight, I did a lot of stretching, and what I found was that the stretching would give me temporary relief, but it wasn't until I really got to the root cause of what was going on, that is when I started to get relief, and then, you know, things got much better and I didn't have any more pain and I could move better as well. So really what I'm going to teach you to do here today, if you are having maybe a similar issue of me as I was, is I'm going to teach you to just retrain this hip flexion movement. So if this feels weird to you, if you get impingement in here, if you feel like this is really tight or painful, then you may be having the same issue, okay? So what we have to do is we have to get you to practice moving into hip flexion and out of hip flexion, retraining these hip flexors under a neutral pelvis and a braced, stable torso. So I'm going to give you a couple exercises that you can do. Let's get to it. So the first exercise is going to be a bird dog plus. So we're going to start down in a quadruped position here. We're going to put the hands right underneath the shoulders and the knees right underneath the hips. Now from here, I'm going to reach forward with one arm and kick back with the opposite leg. Now you may have seen us do these on the channel already, and we can just go ahead and alternate this. Now to do a bird dog plus, we're actually going to stay on one side, and what I'm going to do is I'm going to kick back, and then I'm going to bring my elbow and my knee together, okay? So this is the motion, just like this. So we're working on hip extension right here. You should feel your butt work a little bit. And then hip flexion right here. Now notice that I'm keeping my core very active and my spine is staying neutral, okay? So what we don't want to happen is we don't want to overextend and then flex here. We want the spine to pretty much just stay in the same position the whole time. So what you're going to do is you're going to turn on the front of your core here. We're going to get that nice and tight, and then we're going to extend and flex. Extend, flex. Okay, that is the bird dog plus. The next one we're going to do is similar, but we're going to get into a plank position, okay? So I'm going to come here. I'm going to do this on my hands. And we're going to get in a good plank position where my core is really turned on. My abs are taking a lot of the force here, right? And I'm doing this by kind of bringing my hands and my feet towards each other, right? That force is going to create a lot of tension in my core region. And now from here, I'm just going to flex one hip, flex the other hip. So what I'm doing is I'm moving in and out of hip flexion while keeping a very neutral spine and a braced torso. So I'm not letting myself dump into anterior tilt here and doing this. And if you do that, it should feel wrong, okay? And if you feel like you're doing that, you just want to readjust, get yourself back into a good plank position with your core turned on, and go back to marching these knees up, moving in and out of hip flexion. All right, the last one we're going to do is a heel tap. So this is a very simple one. We're going to just lay down on the back, just like so. I'm going to bring my knees up so my hips are about 90 degrees and my knees are about 90 degrees. And this is an exercise that we have in the fixed anterior pelvic tilt program. This is a great exercise for retraining your core to stay stable, and once again, moving into hip extension and then hip flexion, okay? So this is a very simple exercise to just start getting those hip flexors to do their job, which is to flex the hip, but under the right conditions where my torso and my spine are neutral. So my lower back stays flat to the ground here. I'm not gonna let it arch up like this. I shouldn't be able to get my hand in there. If you go down to the ground, you should not be able to squeeze the hand in there, right? My lower back is flat, and keeping my knee at 90 degrees, I tap just like this. Okay guys, that is 3 simple exercises that you can do to start to retrain your hip flexors to work with a neutral, stable torso, so those guys can do their actual job, and so you will stop getting that impingement feeling and getting that tight front of the hip feeling as well. Guys, thanks for watching. Be sure to subscribe to the channel and check out Upright Insider, where we have tons of videos on different exercises and exclusive content as well. Remember, pain sucks, life shouldn't. If you enjoyed this video, then please like and comment. And be sure to subscribe to Upright Health for more great content in the future.